The topic of my presentation is the impact of COVID-19 on food choices among student nurses. And the previous presentation really was a good segue into this as well on COVID-19 and in academia. I have done previous research on childhood obesity and adolescent obesity, and I was in 2020, because I was listening to how much weight people were gaining and other things that were happening to people staying at home, sitting more and not going out. I wanted to know what the impact of COVID-19 had on weight and food choices. One of the other reasons is because in early 2020, our supermarkets, the shelves were bare. There were long lines waiting to get food, and people were being very, very anxious about access to food. And our literature does show a correlation between, isolation, mindless eating, binge eating, which a lot of people were doing because they were confined at home and, being anxious about getting food. And when they did get food, perhaps buying energy-dense foods and not so much healthy foods. Our campus was closed, like many other school campuses were closed. Our campus closed down in March of 2020. And in New York City, we were very hard hit during the first wave of the pandemic. The peak cases in the spring of 2020 were 6,258 cases of COVID and 755 deaths. Our students in the nursing program at Lehman College, we have traditional RN, traditional students, we have RN to BSN students, we have accelerated students, and we have in the graduate program, a family nurse and a pediatric nurse practitioner programs. And some of our students were those who are registered nurses going back to school, were working in hospitals, taking care of the people who were sick and dying of COVID. Some of our students tested positive for COVID. Fortunately, we didn't have any student deaths, but some of our students also lost family members as a result of COVID during the first wave. So it was a very, very stressful time for our students. Also, because our campus was closed, we too had to switch to online learning and trying to find places for our students to do clinical practice. And in actuality, we had no places for students to do clinical practice. None of the hospitals were accepting student nurses because they were, of course, being focused on caring for the very, very many sick patients who had COVID and not having extra people there and not running the risk. Also, the problem for our FNP and our PNP practitioner students was going to clinics and physicians' offices to do their clinical practicum, and none of those places were allowing students to come in either. So our students had no clinical. We had to switch to remote learning using Blackboard and Blackboard Collaborate. Fortunately for us, our department has used Blackboard quite a bit, as well as in-person classes. So our program is an in-person program, but we had to switch to remote learning. And we had to scramble for clinical simulation software to supplement students' clinical experiences. And we also, for our advanced practice students, we had to delay their clinical into the summer when the numbers of COVID dropped significantly in New York City. Our campus at Lehman College is located in the Bronx. The Bronx County is it is the poorest county and has some of the most challenges economically, educationally in New York City. So, that was another reason thinking that there might be food insecurity for our students, many of whom, exactly the majority of our students, come from counties in New York City and some of the surrounding suburbs. But wanting to know how these long lines, the lack of food, the lack of food items, closing of campuses, delays in clinical, not clinical, all of those things, how they were impacting them. Were they experiencing anxiety? So I decided to ask those questions. And so the purpose of my study was to determine the impact of COVID-19 on the food choices and food-related issues of student nurses from an urban university in New York City. And the food-related choices, I developed an instrument based on some of the social determinants of health, including food cost, anxiety, food access, some of those things. And I'll share with you some of the other questions that I asked the students. The method that I used was a descriptive exploratory study. I used a 15-item multiple choice survey asking students whether these various factors impacted them, did not impact them, or had no change at all as a result of COVID. And I also asked about their demographic data, their work, whether they were full or part-time working students or not, or unemployed, ethnicity, age, and where they live, the residence of the students, which was important. So that 15-item survey included questions about anxiety, weight gain, healthy and unhealthy food choices, such as fruits and vegetables and energy-dense foods, whether or not they were cooking more at home, they were doing takeout meals, were they eating more? Those are the kinds of questions that were asked on the survey. I did get IRB approval from my college to begin the study, and I used a listserv from the university of our pre-nursing and student nurses who were enrolled in our program. Our pre-nursing students are those who are, of course, trying to get into the program with their pre-nursing science courses. I did not have anyone, excuse me, from the pre-nursing pool population participate, and emails were sent out twice. I got a very, very small sample, I must say, and I'll tell you at the end that I'm going to try to do this again as a retrospective study. We have 486 students in all of our programs in total, and I only got 71% response rate. I think one of the reasons why I got such a low response rate may have been because of the anxiety students were experiencing. We were off campus. I didn't have an opportunity to have a face-to-face going to the classes and meeting with the students, although I did reach out to faculty to try to have them encourage their students to participate. The questionnaire was submitted by our Microsoft 365 software program, and it was an anonymous survey. So I did send the emails out to students. Those who responded to the survey anonymously. And I can just share with you the students who participated. Let me go back to the original. So the majority of the students that participate, I'm sorry, this is a little bit small. I'll have a larger slide later on. But the students that participated in the study were a very, very small percentage, 2 students from our advanced certificate program in FNP, 23 from our family nurse practitioner, 8 from the accelerated. The traditional students were the largest, generic students. The RNBS were 10. And there were 3 submissions that were incomplete, so I could not use those. The largest groups who participated were the undergraduate traditional or generic students, followed by the FNP students, which is comparable to the percentage of students that we have in our program. And so are the others. So although it's a very, very small sample, it is small but representative percentage-wise of the student body in our nursing programs. Data analysis was conducted using correlation between variables and the impact of COVID-19. Summary statistics and statistical tests were conducted with R version 4.04. And because of small group size, Pearson chi-square test was used for correlation and p-value to test association in cross-tabulation samples. I did have a statistician from my university to help run the data and help with analysis of the data. So overall, food choices were impacted. COVID-19 did impact food choices. And I'm only showing the slides, although there are many other analyses run. I'm showing the ones that have significance. So for the COVID-19 did impact students' food choices. So overall, everybody, all the students were impacted. There was increase, the blue bar showing that it was impacted, some more than others, but it did impact them. Their ability to afford food was impacted by almost all of the students. The very small number of advanced certificate students, they were not, it didn't change their ability to afford food. But the ability to afford food decreased among our generic students and especially among our accelerated students. Those are students who may be working part-time or not at all. And then the other students, the RNBS and the FNP students were unchanged. For the majority of them, their ability to afford food was unchanged. But these students are working and have a salary. So just going back, food choices impacted. I did ask questions about healthy food choices and water intake, but the findings did not show a high degree of significance, so I'm not sharing that information, but I did ask those questions. Weight was affected across the board. As you can see, 51% of the students gained weight during, the COVID pandemic did impact their weight. Some were unchanged and some actually decreased in weight. Perhaps because they weren't eating, they were busy working extra, not quite sure why that was. I can only imply, because of all the things that were happening because of COVID-19. Food portions was impacted. As you can see, among our FNP students, they were eating more. And the accelerated students about even between decrease in food portions and increase in food portions. And our traditional students had somewhat of a decrease in their food portions, while our RNBSN students, really the majority of them, COVID didn't impact their food portions at all. So for many of the students, there was an impact on their food portions, which would correlate to them gaining weight. This particular slide, which shows anxiety related to food access by residents, didn't show a high significance level, again, because of a small sample, but I was very curious and I thought it was an interesting thing to identify and to, in future, follow up on and to try to make some sense about, to understand why this happened. Students who resided in counties outside of the ones that were identified in the survey. So those that are more close to us, I did have them listed, but we have students who live in other counties just north of New York City that that attend our program, and those students had a they had a really high number of high level of anxiety due to COVID and food access. So that was really something that stood out for me. And based on the literature and other research studies, we know that anxiety does lead to, as is correlated with binge eating and then weight gain. And weight gain, of course, is correlated with cardiovascular diseases and other things as students advance in age. I do want to share that our students, they in this study, they range in age from young adult to middle age population, with the majority of students in the young adult population. The other level of anxiety that was interesting as well, although not a high level of significance in terms of the p-value, was anxiety, again, anxiety by ethnicity. Among the Black or African American students, there was an increase, not so in the Asian population, again, higher in the Hispanic or Latinx population. White students also increased. And those who identified in the other category, there was no specificity for them to identify what other category they were in. They could have been biracial students or students who did not identify in any of these other ethnic groupings. But it's important to note that there was anxiety related to food access during COVID. And so anxiety appeared twice. And again, anxiety and binge eating and obesity are correlated. I did not do that type of cross tabulation in this study, but it is, it does support findings from other research. I should have added in the beginning, this study that I did, the data that I collected was during the second wave of the COVID pandemic, during September through December of 2020. And this was before there was the COVID vaccination available to anyone. And although the numbers of COVID cases did decrease during the summer of 2020, they began to peak again, as had been predicted. They began to peak again during the fall of 2020. And then the Delta variant was identified, and other strains of the virus were identified in other countries and then began to be identified in the United States. And so it was during that time period that I collected data, but students, asked about the impact of COVID generally, not just during that time period, but I did collect the data during that time period where their recent memory may have impacted on their responses to the survey questions. So just summary of the findings is that weight increase for 51% of the students, ability to afford food, decrease ability to afford food, 75% of the accelerated and traditional students, 48%. Anxiety related to COVID, depending on residence, 84.6%, and those were students identified in the other northern part of New York State, and ethnicity, 81.8%. So I'll go back to my original slide here. In conclusion, the impact of COVID-19 has both short and long-term effects on dietary choices. These can be related to food insecurity and stress, causing effective and ineffective coping behaviors and poor health outcomes. Our college did offer counseling services, which more than likely were remote because our campus was closed. I don't know how many students in this survey, in this study, took advantage of that. And they did offer sites where students could get food. And I don't know how many people took advantage of that either. But because people were remote and not coming to campus, they may not have taken advantage of any of those services. Implications are that assessing the nutritional status and food-related stressors of young adult college students is an important aspect of primary care for nurse practitioners, as it is for all nurses doing intake on patients. And I think that's an area that we as nurses can really do a lot of asking patients, asking these students, asking young adults about their nutritional status and also their food-related stressors such as anxiety, and not just handing out information on where to get help, but helping them to identify it and being able to identify the signs of stress in our patients. Because we are, COVID is still with us. There is the Delta variant, although more and more people are getting vaccinated. And on our campus, our students, our nursing students, it is a requirement for clinical placement now because our clinical agencies, our affiliates, are demanding that requirement too. So although we've gotten some pushback from the very few students, our students do have to be vaccinated. However, we know that vaccination isn't 100% effective against COVID, and so there may still be some anxiety. We don't know the long-term, what's going to happen with the Delta variant long-term, and those are some things that we need to be aware of, that anxiety and stress are related to what's going on with COVID and how this impacts our students. So, I hope to get a larger sample in another retrospective study. I would love to do a study of other students across the United States, because I know different states have, various responses to COVID, and also internationally, what's happening with student nurses across the country and their anxiety related to COVID and food insecurity, and how that certainly will impact on the care that they deliver to their patients. So thank you very much. If you have any questions.